Hello again, this is Dr. Drew Hall with Upper Cervical Healthcare of Los Angeles and Carson. Today what I want to talk about is dizziness and TMJ. Is there a connection between the neck, TMJ, and dizziness? And after 18 years in practice, seeing about 11,000 patients, I can say absolutely 100% yes. There is a connection between TMJ, the neck, and vertigo type issues. The reason being, the TMJ joint is the second most highly innervated joint in the body, and what that means is there are pressure sensors that they call mechanoreceptors and other proprioceptive nerve endings that take input from the joint, and that input fires back into the brainstem, which is that part of the nervous system right here. And then there's pathways that go into the vestibular apparatus. And as you know, the vestibular apparatus is what controls hearing. So TMJ joint, also the joints from the neck have the most highly innervated joints in the body. C1 in the head, which is called the superior articular facet of the atlas, which is those two guys right there. They have more nerve endings than any other joint in the whole body per square millimeter. And so it's very important, that joint, in sending input into the back part of the brain, which controls the balance centers. So what we found in our practice, a third of our practice are cases that have vestibular disorders. That's Ménière's disease, vertigo, tinnitus, disembarkment syndrome. And so we find that probably over half of the patients with TMJ problems also have dizziness problems or vestibular problems. We also find people who have vertigo problems have TMJ problems. So there is an absolute connection, and here's what we feel the connection is. The head weighs 10 to 12 pounds. C1 is that guy, it weighs 2 ounces, and those two little joints right there basically bear the weight of the head. And so because you have a bowling ball sitting on a 2-ounce bone, the head-neck junction is the most vulnerable to injury, and as a consequence, as we go through life, there are injuries that happen, sports injuries, car accidents, slip and falls. There's different blunt head type injuries, acceleration, deceleration injuries that can cause the upper neck to dislodge and lock. Now there's a cascade of effects that happen once that upper cervical spine becomes injured. The joint, those two joints, there's a very fibrous ligament that surrounds them. This goes for all the joints in the body. But when you have an injury and that segment dislodges, that joint capsule that gives that joint integrity gets damaged, the vertebra gets locked out of position, and when you have a joint that becomes misaligned, you get the muscles in that particular area to become tight, and then there's a cascade of postural effects that happen. The normal curve in the neck typically flattens. When the neck flattens, that changes the architecture of the joints, which further causes input from the joints in the neck to send bad information in the CNS and the brainstem. And then because the mastication muscles are controlled by the trigeminal nucleus, it's the 5th cranial nerve that sits right in here in the brainstem. That area is the seat of control for mastication muscle tone. So you have an injury to the neck, the joint dislodges, it affects the neurology, it causes the muscles of the neck to tighten, which straightens the neck, which causes more aberrant information from the joints in the neck because they're not how they should be. That affects the postural center, which also affects the trigeminal nucleus, which causes the muscle tone on one side of the jaw to become tighter than the other. What does that do? It pulls the TMJ joint out of balance. And I just told you the TMJ joint is the second most highly innervated joint in the body. So now we have jaw out of balance, TMJ out of balance. We have abnormal input from the TMJ now going back into the brainstem, again affecting the vestibular apparatus. And as you know, the vestibular centers, that's what controls balance. So all three of these factors have interplay: vertigo, TMJ problems, neck injury. But most usually, the neck injury is what precedes the TMJ. It precedes the vertigo. It precedes the tight muscles in the neck. And so a lot of these cases that we've seen, they've been dealing with secondary and tertiary problems. Many of them have taken medication for their dizziness. Many of them have been to a TMJ specialist. And yes, that absolutely can be helpful. Those splints will help TMJ, but our job in the office is to get to the root cause of the problem. And we find with many vertigo, TMJ, tinnitus, Ménière's disease cases that this upper cervical spine is misaligned, it's affecting the neurology in the body, and once we can find out exactly how the segment is out of position through precise imaging, once we know how it's off, we can introduce a very precise force into the segment to get it back under the body's control. Now, once that segment that's locked is back in motion and under control, there is another cascade of effects that happen. The body will start to go through a postural straightening process. The muscles that have been affected in the TMJ and the neck and the mid-back, and a lot of times through the whole spine, will start to go through a balancing act. That joint that's been damaged, the ligament will start to heal, mend, and repair and become tighter. The straight neck that's happened from that neck injury will slowly start to come back into its normal cervical lordosis. So if you're someone who's dealing with TMJ, tinnitus, vertigo, dizziness problems, they are connected, and they're usually connected through this upper neck injury. And if you're looking for a natural alternative to fixing the underlying cause of this, we have 2 offices in the Los Angeles area. Our Los Angeles office number is 213-399-7772, and our South Bay Carson office is, the phone number is 310-324-6172. Again, we offer a free consultation. You can call either one of those numbers, whichever is closest to you. We'd be happy to schedule an appointment and run you through a 45-minute history consultation and neurological findings to determine whether this is the cause of your problem. If you're outside the Los Angeles area, you've come across this video, you can call one of those numbers. We'll be happy to find an upper cervical doc in your area that can help you back onto the road towards health. So thanks for listening.